Testing shoulder external rotation, also known as lateral rotation. Patient will be in a prone position as shown here. First thing you'll have your patient do is perform external rotation to the best of their ability. So go ahead and do that for me, please. And now we'll come back down. Because you was able to do that, that is a 3. I will now stabilize the scapula. Go ahead and do that motion about halfway. And then I will apply resistance to the forearm. Now, no, I am crossing the elbow joint. This is one of the few exceptions that you will do this. Now resist me. 3, 2, 1. Okay, let back down. Testing shoulder external rotation, gravity eliminated position. Patient will be in a prone position as shown here and have the arm hanging off the table. You will then have your patient perform external rotation to the best of their ability with their palm facing you. So go ahead and do that for me. Okay, thank you. Because she was able to do that, that is a grade 2. If she could not do that, then I would come up and I would palpate the infraspinatus and the teres minor that are located about right here. If I feel these muscles firing, that is a grade 1. If I do not feel them firing, that is a grade 0.